being able to talk about the cultural values that impact us, being able to talk about pakikipagkapwa, togetherness, being able to talk about pakikisama, empathy. And so in all the ways that our cultural values informs us and has us be a community and how we can rise together. My name is Eddie Martin Gana Jr. I'm a licensed clinical social worker. I'm the clinical program manager of SIPA, Search to Involve Filipino Americans. With our mental health outreach program, we have been able to provide psychosocial assessments, community linkages, case management, psychoeducational workshops, as well as trainings for our community-based trainings.
As a mental health clinician, we work with people facing challenges and also moments of strength and resilience, and it's a lot of information to take in and to process as a therapist. And so reaching out for therapy for myself helped to feel more prepared and to feel supported during this pandemic.
There were stresses about doing school remotely, and I work at a University of California school, so it's very competitive and very stressful, and just trying to figure out how to be a successful college student while managing family responsibilities, while managing their own stress about what was going on.
Kind of the lack of connection, the disconnection that happened during the quarantine really wasn't helpful for everybody. When everybody was kind of feeling the stress of all the adjustment and the transition, it was helpful for everybody to know that they were not alone in the experience, get support from each other, learn from how others were coping as well. And so helping kind of facilitate that communication and that connection.
People had to start really tuning in a bit more, start prioritizing their values, start really prioritizing their well-being and setting boundaries in ways that they never really had to put at the forefront.
I strongly feel that instead of focusing on other programs or institutions, we should divest from the police and invest in our community. So just talking about how can we change the systems that are in place to ensure that we do have safety, that we do have community safety, and what does that look like?
I personally work with SIPA through our Mag-usap Mondays, which is a virtual workshop that provides psychoeducational information about bringing awareness and breaking down stigma about what is mental health and what is wellness.
Even just the education material that I see, and that even sounds so formal, education material that I see, but on social media and having kind of all of that information, and it's said simply, but in language.
Having an organization as established as SIPA to kind of really build and connect the Filipino American community in LA and even across with the virtual environment, people were able to just seek these resources that probably weren't able to in the past.
I'm really grateful and happy that SIPA has done such a great job in extending its services and helping to decrease mental health stigma, because our community really needs it. We're like the top Asian population for depressive disorders, and so we just need to figure out how to make it okay to not keep saying, okay, I'm doing okay.